Chapter 26: Infectious Disease Prevention and Control. Worldwide concern about infectious diseases has increased with the growth of migration and also mobility of persons in the world. As people move from one place to another, they bring their diseases, levels of immunity, and resistance to diseases, and the viruses or bacteria that they may harbor that they have not emerged as diseases in them yet. The topic is very complex and includes a study of wide range of variety of organisms, the pathology they may cause, and their diagnosis, treatment, prevention, and control. And the topic also requires a global perspective in that currently some infectious diseases are reappearing in the United States, such as measles, when the recent increase has been attributed to children traveling to countries where vaccination is not as high as in the United States, or children traveling here who have not been vaccinated outside of the United States. Historical and current perspectives. As of 1900, communicable diseases were the leading cause of death in the U.S. TB was a previous leading cause of death. By 2000, with improved nutrition and sanitation, vaccines, and antibiotics, we'd put an end to this epidemic that once ravaged the entire population. It is still endemic in the United States. In 2011, 10,521 new cases were reported, and so this is a disease that has not been totally eradicated, but it's no longer controlling and destroying entire populations. As people live longer, chronic diseases have replaced infectious diseases as a leading cause of death, such as cardiovascular disease and diabetes are more epidemic. Infectious diseases are still the #1 cause of death worldwide, however. And new dangerous diseases are emerging, and old familiar diseases are taking on different, more virulent type characteristics. An example of this are the medical and drug-resistant organisms that have become prevalent with overprescribing of antibiotics. Surveillance and communicable diseases. Surveillance gathers the who, the when, the where, and the what, and these elements are used to answer why. And a good surveillance system, and I highlighted this, is systematically collects, organizes, analyzes current, accurate, and complete data for a defined disease condition. So we will look at temporal or geographic clustering. We will look at diseases outside of the age group, such as chickenpox in adults instead of children. And we'll look at if there are certain symptoms, such as a large number of flaccid paralysis, that could be possibly related to bioterrorism, and that definitely would require surveillance. There are a list of reportable diseases. This varies by state. I posted a link here, and I'll post it in D2L, of the list of reportable diseases by state. And the resulting information is promptly released to those who have a need for effective planning, implementation, and evaluation of disease prevention and control programs. And it's only as good as the people who report to the system is what makes it most effective. Emerging infectious diseases are those in which the incidence has actually increased in the last 2 decades or has potential to increase in the near future. And some of these I'll give you some examples. The hantavirus pulmonary syndrome in 1993, in the Four Corner area of Arizona, Native Americans had a higher incidence of this hantavirus pulmonary virus, and it is caused by a rodent-infested environment. And at first it was thought that this was a disease that was primarily obtained by Native Americans, but it was since discovered through evidence-based practice and through research that there had been a real mild winter and an increased rat population, and these people just happened to live in that corner of the United States. In fact, there were visitors to Yellowstone National Park who also obtained the disease, and it was from staying in cabins or yurts or temporary housing there, where mice had access to those areas during the off months, and then just aerolizing that the rat droppings had probably contributed to that. As far as HIV and AIDS, there's been a rise in opportunistic diseases in this population due to the immunosuppression of the disease process. Things like toxoplasmosis and cryptosporidiosis that ordinarily is found in dirt, is just found around, but this has certainly gotten better with the advent of the highly effective antiretroviral medications. Another opportunistic disease among persons persons with HIV and AIDS is pneumocystic pneumonia. And if a person presented to the hospital and it looked like pneumocystic pneumonia and the person didn't, present or say that they had HIV or AIDS, that would be something that they definitely would be checked for. There are new influenza viruses such as type A H1N1 that was about in 2010, and in fact they that year issued a second flu vaccine because of this virulent flu. The West Nile virus, which causes encephalitis. It causes a couple different things, but one form, the deadly form, is human encephalitis, and it causes it is from infected birds and mosquitoes, and this is changing by itself. And I don't know why I did that, but anyway, and so it is caused by infected birds and mosquitoes, we think, coming into the United States. Okay, prevention and control of communicable diseases. You know this about primary prevention, seeking to prevent the incidence of disease by preventing it before it happens. Secondary aims to prevent the spread of disease once it occurs, and tertiary works to reduce complications and disabilities through treatment and rehabilitation. And the role of the nurse, and I want you to write this down because you'll remember it if you write it down. The role of the nurse in prevention is to control, teach, monitor, and treat persons with communicable disease. Agents of bioterrorism is certainly a concern in today's age. I'll just give you an example of some of these. Anthrax is a spore-causing agent. Once was only a problem for animals and veterinarians, but now humans can contract this, and it has actually already been used as an agent for bioterrorism. It can affect the GI tract, the respiratory, cause respiratory problems, or it can cause cutaneous or skin problems. And the treatment for it is an antibiotic and then the anthrax vaccine within a specified number of days once they figure out that that's what the person actually has. And another one is the plague. I will not go into that one. Smallpox once was eradicated in 1979, but and so since it has been eradicated, it would be a very likely source of bioterrorism. Persons haven't been vaccinated for that since 1983, and it is the only part of that bacteria that we know of. There's some located in the CDC in Atlanta and also some in Russia, and they were going to destroy it, but they decided to do more research on it. So if persons who are being deployed, persons who are going to into combat, they certainly have to have the smallpox vaccine. Botulism is caused from uncooked or spoiled foods, canned goods. That's why we have to put up our canned goods following the USDA recommended number of minutes to process food and the correct temperatures to destroy botulism. It causes flaccid paralysis, begins with blurred vision, goes to a paralysis within 12 to 36 hours. Children who are fed raw honey can get botulism, and they refer to it as floppy baby or flaccid paralysis. Tularemia comes from dead animals. Animals who get this will die like in large numbers, so they say not to run over, like to mow over a dead animal. But also you can get it from tick bites, deer fly bites, and it causes ulcers and also some inflammation in the glands to the point of being deadly. And then selected hemorrhagic viruses also could be used as agents of bioterrorism. Vaccine preventable diseases. Vaccines are one of the most important ways of preventing disease. I'll say that again. Vaccinations are one of the most important ways of preventing disease. And the routine childhood immunization schedule, you'll go over that more in pediatrics. But there are 11 diseases that children are immunized against. They are hepatitis B, diphtheria, pertussis, measles, mumps, rubella, polio, H. influenza, type B meningitis, varicella, and streptococcus pneumonia. Measles are pretty rare in the United States. They kill about 200,000 people a year, though, globally. And it causes, it's an airborne, the child coughing, sneezing. Rubella, are also called German measles, are very mild form. In fact, sometimes there's not even a rash, but it involves the glands, and inflammation of the glands, and it's very dangerous for pregnant women and children, very young children. But pregnant women are at risk for congenital anomalies of their unborn, and also stillborn or spontaneous abortion. Pertussis has increased in adults. They think because of waning immunity. Around 2010, there was quite an increase of it. Persons on planes. They think that was where some of that was taking place. But it's very contagious. So if someone in the home had obtained pertussis, children under the age 1 and pregnant women within 3 weeks of delivery would begin prophylactic antibiotics. It used to be a very prevalent disease. It killed a lot of children under the age of 5. So it definitely, and so there are boosters for older persons because of this. If you're over age 65, then you should have, and you've never had Tdap, you should get the Tdap. And if you're going to be close contact with a baby under age 12 months of age, you should also get a dose of Tdap. But for children, children are immunized for this. They're given 5 doses of Tdap, which is diphtheria, tetanus, and acellular pertussis, and it's given to infants until they're 6 years of age. And catch-up vaccine for children ages 11 or 12 can be given if they've missed 1 or more of their childhood doses. And then people ages 19 and older should get a booster of TD every 10 years, and adults under 65 who've never gotten Tdap should get 1 catch-up, and then over age 65. So that is, and let's see, influenza is also airborne droplet, and this influenza virus can survive for hours inside of dried mucus in like a Kleenex or other area where it dropped. There's a greater complications with children under age 2 and over age 50. And there are different types of flu. Type A generally is the one that causes the epidemic and pandemics. B is generally a regional type flu, and C is generally a milder type of flu that persons can have. So some risk factors to lack of vaccine. Some persons who are philosophically or religious beliefs prevent them from immunizations, or they just feel like they shouldn't get, their children should not be immunized. And children who live in an inner city poverty often have incomplete vaccination, and this is due to socioeconomic factors such as parents working 1 or more jobs can't take off from their work because and also travel and those types of things. And this also includes elders who live in the same type of settings, inner city poverty, due to pneumonia and influenza, or they may not, because Medicare, these are free. Immunizations are free through the health department, but persons, there may be some barriers to people getting there and actually getting the vaccines done. Vector-borne diseases include zoonoses. Vector-borne disease refer to illnesses for which the infectious agent is transmitted by a carrier or a vector. Lyme disease was first discovered in Lyme, Connecticut. The parents there saw that their children were having an increased incidence of juvenile arthritis. The most likely place to get this is from mosquito, ticks, deer flies, those sort of things, is in that northeast corner of the United States, although you could get it elsewhere. But most likely people who contract it live up in the northeast states such as New Hampshire and Delaware and Maryland and even down to Virginia. But this Lyme's disease, it causes a bullseye lesion. There's like 3 levels. The first level, it causes a bullseye lesion within 3 to 30 days of the tick bite with a fever, stiff neck, arthralgia, headache, and then if they take penicillin and tetracycline, they may have a very good recovery from that. And you can still check that with a blood test to see if it is Lyme's disease. And then at level 2, additional lesions occur if it's not caught in that first level with cardiac and neuro problems. That may be why the person presents, because they had cardiac or neuro problems. And you can still test in level 2 with a blood sample. Level 3, you cannot do a serological blood test on the person, and they may have permanent and ongoing arthritis. So one of the main main things to do is to prevent by wearing DEET when you're outdoors, hiking, horseback riding, hunting, those sort of things in grassy areas, places where ticks and other vectors might be living. And be very careful about removing ticks. That don't squeeze them when you're removing them, and just that's one of the things that they say that you should do. And then there's Rocky Mountain spotted fever, which causes a fever and rash, kind of similar to Lyme's disease. Zoonoses are things like bat bites, rat droppings, things from white-tailed deers, rabbits, and squirrels. That carry diseases. Rabies is 100% fatal if untreated. So if a person got a wild animal bite, and you couldn't capture the animal, you didn't kill the animal, then you would have to begin to have some type of, you'd have to begin the vaccine, which is the human diploid cell vaccine, and it's 5 1 milliliter doses into the deltoid. So any untreated animals, they'll put them, like domestic animals, they'll put them on 10-day isolation to make sure that they do not have rabies, but the person generally goes ahead and begins, if this animal has not had their rabies shots, then they generally go ahead with the human diploid cell vaccine for the affected person. Parasitic diseases, intestinal diseases like pinworms, HIV, immune suppression, intestinal things like pinworms. Pinworms are common in areas where people live together, also like nursing homes, children in schools. And there's just like a little thread-like looking worm that that people can get, and it shows up generally at night. I don't know why that's, or that maybe that's when people just notice it more often. But and then there's parasitic, other opportunistic diseases, the infections that we talked about related particularly to people who are immune suppressed, parasitic, opportunistic infections. But also in the book there are on page 496 there are the different types of parasitic intestinal infections, such as the roundworms, whipworms, hookworms, and tapeworms. Malaria is one of those, so that that can be found inside of water is one source, is where they definitely can be found. Okay. And then disease of travelers. Individuals traveling outside the U.S. need to be aware and take precautions against potential diseases they may be exposed to. A traveler may return to the U.S. with an unplanned souvenir, and health professionals who are taking a client history of somebody who's had recent travel, then they need to check them for just any kind of symptoms that might be related to some type of travel related disease. You definitely do not want to eat food like off of from food vendors. Like if you're on a cruise and you get off the ship, you want to be very cautious about eating food out like that. Malaria is a bloodborne parasite, and there's no vaccine for that. Prevention will be before and after, related to not being in areas where there's mosquitoes, wearing I can't even say what it is, like DEET type of prevention. And then if malaria should happen, then it can even happen like 1 year after travel with fever and chills. Generally, there's no one type of anti-malarial that is best to use, and they may use duplicates of that. Other foodborne and waterborne diseases include Salmonella, E. coli, Shigella, Giardia, and those are on page 494. Just some things that you can do to prevent foodborne and waterborne diseases, and also is if pasteurization for milk, and dairy products. Raw vegetables should be washed because they can carry trichinosis, tapeworm, and flukeworm infections. Dairy should be refrigerated. So precaution is one way we can prevent foodborne and waterborne diseases. And here's an important concept, that if 2 or more people are infected by a source of water, then surveillance would begin. If it's 1 person, then there's some surveillance, but if it's 2, then there's a really heightened awareness that there might be some contamination of the water source. Health-acquired infections. Health-acquired infections are acquired during hospitalization. 1 in 20 persons who are hospitalized will contract a health-acquired infection, and they may involve patients, healthcare workers, visitors, or anyone who has had contact with a hospital. And I know in hospitals in this past year, I've noticed that the healthcare workers are asking visitors to make sure that they wash their hands, in addition to the precautions that were taken during flu season. And then universal precautions are practiced as a procedure to prevent exposure to blood-borne diseases, with the belief that anyone could have some type of blood-borne illness. And that is the end of this lecture.